Just about 7:35 this morning. Turning now to You Ask, We Answer. Dr. Syed Hussain from Trinity Health joining us once again to answer your questions. We get them into our newsroom just about every day, and we answer them as they come our way.
Absolutely. So once again, we're saying good morning to Dr. Syed Hussain. Thanks for being with us.
Thank you for having me.
All right, first question, let's get straight to it. It comes from Melissa. She asks, if I got my first shot in another state, but I'm living in New York City now, and my second shot is due this week, can I get my second dose in New York? Everywhere, or are they just several places that I can do this?
Please, so the short answer is yes, you may get your second shot where you're currently residing, even if you received your second shot out of state. We've had instances in Connecticut where residents have come back to Connecticut, they received their first shot out of state, and we've administered at Trinity Health of New England their second shot. It is very, very important that you stay as close to the 3-week mark for Pfizer, 4-week mark for Moderna, and please schedule your second dose appointment as soon as possible.
All right, moving on. We had a lot of questions about the J&J vaccine. You've walked us through all of this. So Jeff wrote into us saying he got the J&J vaccine 2.5 weeks ago. Then it was paused. That pause has now been lifted. He wants to know, and others have asked, should they get another vaccine? Should they think about a Pfizer or Moderna? You know, does 2 make sense? Is it absolutely out of the question? What do we say to Jeff?
So, Jeff, if you've received your first dose and only dose of Johnson & Johnson vaccine, you're considered vaccinated from a CDC perspective. There's no need to get Pfizer or Moderna. The only reason why we would need to think about a second vaccine is if there's a booster that's necessary down the line, or if the COVID-19 vaccine becomes an annual vaccine. So for all intents and purposes, please stop worrying. You're vaccinated. You've gotten your 1 shot, and that's what's required from a Johnson & Johnson perspective.
All right, doctor, a lot of restrictions are being lifted, specifically here in our state, big dates coming up in May. What are your thoughts on the Biden administration planning to relax outdoor mask guidance?
So let's look at the facts. So we know the risk of contracting COVID-19 disease is 18 times higher in an indoor setting compared to outdoors. We also know, based on studies that have looked at COVID-19 cases, that less than 10% were contracted in an outdoor setting. So we know it's safer to be outdoors, but we also need to look at the entire picture. We still have hundreds of people dying of COVID-19 disease in this country alone. So with all of that in mind and in context, it is safe, reasonable to expect the CDC to revise guidance on mask wearing in an outdoor setting, which we expect new guidance to come out any time now, possibly today. But indoor masking is very, very important. And one thing I do want to remind viewers is, I hate to be a downer here, but in the months to come, we will need to be very flexible. Given the rise of variants, we see this horrific rise in cases in India, for instance, from a double mutant variant. So public health measures are our best weapon against this virus. So we will need to be nimble as we move forward.
And Doctor, one last question if we can. Yesterday we shared with our audience that about 5 million Americans have not gotten their second vaccine. What is the concern there? What do you say to folks who have been hesitant to go up and get that second shot? Please
get your shot. We know that the 2-dose vaccine series is effective. Based on the studies, more than 95% effective, more than 90% in real world data coming out from Israel and other countries. Please get your second shot, even if it's been more than the CDC recommended 4 to 6 week period between your first dose and second dose. It is critically important you get your second shot to ensure that you have lasting immunity.
Dr. Hussain, thank you so much once again. Always great to have you here and help us out with these questions.
Indeed. Thank you. Have a great day.